And there are facts and figures that we all need to know about. And I don't have those facts and figures, but lucky for me, there is someone here today who does, and his name is Mamadou Samba. Let me just tell you a little bit about him, and I'm just going to read from the bio back here a little bit, okay, if you don't mind. I know these things can be a little embarrassing, but it says here that you're originally from Dakar, Senegal, and you're well known as a leader and a voice in the African immigrant community in the Washington, D.C. metropolitan area. And you're also involved in many causes related to the African diaspora, immigration, and community development. I do know that one of those things is to help bring awareness to issues like this. And we thank you for your work through the mayor's office and just in the area in general. Without further ado, Mamadou, please come up and give us some facts and figures about cancer in Africa that we may not be aware of, but these are things that we all should know, and hopefully take that information out to the greater community and help shed light on this horrible, horrible disease that we can all help fight. Mamadou, please come up here.
Good morning. I am Mamadou Samba, and I'd like to start by thanking the African Women Cancer Awareness Association for giving me the pleasure of being here today. I'd also like to thank Ms. Ife, who also serves on the Commission on African Affairs with me, and she's a very strong advocate for our community and for the cause. Just a quick correction, I'm going to speak on facts on cancer on African immigrants in the United States and in Washington, D.C. Okay? African Americans have the highest mortality rate of any racial and ethnic group for all and most types of cancer. In 2009, African American women were 10% less likely to be diagnosed with cancer, but 40% more likely to die of cancer than non-white Hispanic women. Now, I mentioned African Americans. You might ask, why am I speaking about African Americans? And this is only because in most data collection methods like the US Census or the American Community Survey, whether you are African or not, we are all boxing under one category of Black or African Americans, which means that unless further research is done to collect aggregated data like country of birth information or language spoken information, we can all consider ourselves here to be part of that group with the highest mortality rate of cancer. In 2012, I conducted research on African immigrants in the Washington, D.C. metropolitan area on behalf of the Mayor's Office on African Affairs. The research aimed at critically assessing and communicating relevant information affecting African immigrants and promoting debate focusing on reducing disparities, particularly health disparities. The report found that when compared to other immigrant groups, African immigrants are the healthiest, period. However, when we dig deeper, the results are very surprising. Cervical cancer incidences in Africa show high levels of up to 40 per 100,000 women, compared to rates of 38 per 100,000 women recorded in the second U.S. National Cancer Survey of 1947, which means that if you look at the rates of cancer today in Africa, it is higher than it was in the U.S. back in 1940, just to show you how much work we have to do. Studies have demonstrated that cancer incidence patterns for first-generation immigrants reflect those of their native country, right? Suggesting there are elevated risk of cervical cancer among first-generation African immigrant women living in the United States. In other words, the studies suggest that when you look at the rates of cancer of African immigrants in the United States, they are very similar to those that we find in Africa. In other words, we can conclude that there exists a very high risk of cancer among African immigrant women living in the United States, which is scary. A study of African-born residents in the Washington metropolitan area showed that among African women, 40 years and older, 44% indicated they never had a mammogram. And among those who were 18 years and older, 34% indicated they never had a pap smear test done. Between 1996 and 2009, there were 45,119 known cancer diagnosed cases in the District of Columbia. When I say known, I mean there are many instances where, country of birth isn't recorded, or people just don't want to reveal their status. So there were 45,119 known cancer diagnosed cases in the District of Columbia, and African immigrants represented only 308 of those cases. I know that may sound like a very low number, which on one hand could be due to the fact that African immigrants are the healthiest, period. But on the other hand, data that we have suggests that, again, relevant information like country of birth and language spoken information are routinely unavailable in most state health surveillance data reports. In other words, when most of us go to the hospital and we check out or fill out a form, the part that mentions which country we're from, we tend to overlook that for different reasons. One, we think that for different reasons, like some immigration status, we may get deported, or we don't want people to know who we are, or we don't want to know, we think that that information will allow someone to identify who we are, and that's not the case. So that information is missing. So when you look at those kind of reports, there's a very low number, but if everybody did report information, we could find that there's a very high number of cases. So such information is vital in finding and analyzing data over time, and identifying cultural-specific health concern. And most importantly, it would allow for organizations like the African Women Cancer Awareness Association to advocate for resources and services for African communities across the United States. African immigrant women face a multitude of barriers to cancer screening and treatment. In fact, the most significant challenge in detecting cancer among ethnic minorities, particularly African immigrant women, is social stigma. And what I mean by that is, we all know what it is. We sometimes in the African community, we don't want everybody to know who we are or what we have, or sometimes we don't even want to go to an African doctor because we don't want that doctor to know about our things. So all of those contribute to the fact that African women generally do not feel comfortable with breast cancer examinations or participating in certain health studies. And the results are often unwillingness to get tested or examined, and thus further delaying known important health status, and even delaying certain preventive measures and medical treatment, which are vital. Particularly true among African immigrants in the United States for less than 5 years. In other words, those who've been living here for less than 5 years. Access to health care and access to this very complicated healthcare system is a major challenge. For example, in most African countries where health insurance does exist, if it exists, most are government sponsored. But when we come to the United States as immigrants, the first thing we are faced with is a very complicated, very complex healthcare system, composed of fees for service, HMOs, PPOs, POSs, and some with every other letter of the alphabet. In conclusion, while African immigrants generally report superior health status among all immigrant groups, our collective lack of knowledge and awareness contribute to the festering of health disparities in our community. Within this very great and diverse, rich African community, consistently promoting discussion around health issues, particularly cancer, is critical in reducing and eliminating disparities in prevention and treatment. So while I'm thankful for this great association, we all have responsibilities in helping us achieve this goal. So I'd like to close by encouraging everyone to continue to support this organization and continue to support those among us that suffer from cancer. Thank you very much.
Mamadou Samba, thank you so much.